Welcome back, everybody, for another deep dive. Today, we're going to be tackling something that's pretty essential for anyone involved in healthcare, and that is ICD-10-CM coding for hypertension. We're going to try to unravel some of the trickier parts of this and highlight what truly matters for patient care research and just making sure we get accurate billing done. And today, we're going to be referring to the Absolute Medical Coding Institute's Medical Coding Guidelines MCG Manual. We'll have a link to that down in the description.
It's great to be back.
It's always fun having you here to help kind of break down this stuff because it can get pretty complex.
Yes, it can, and the guidelines are very extensive.
Right, and they're super important to follow.
Uh-huh.
One of the things that kind of stood out to me when I was taking a look at this was this concept of a presumed causal relationship between hypertension and heart or kidney involvement.
Hmm.
Can you kind of unpack that for us a little bit?
Absolutely. So ICD-10-CM presumes a causal relationship between hypertension and heart or kidney involvement. Unless the physician specifies that the involvement is not due to hypertension, it is coded as related.
So even if the documentation isn't super clear, we're just defaulting to there being a connection.
Yes, the classification presumes a cause and effect relationship between hypertension and the heart and kidney.
Okay, so that seems like it could get a little tricky.
Yeah, that's why clear documentation is very, very important.
Right, because if it's not documented, we're kind of just making assumptions.
Right.
Okay, so let's dive into some specific scenarios here.
Mm.
What about hypertension with heart disease? How does that work?
Okay, so if a patient has both hypertension and heart disease, we would use a code from category I-11, which is hypertensive heart disease. But we need to add a code to specify the type of heart failure that's present from category I-50.
So we're essentially acknowledging that the hypertension is a contributing factor to the heart disease.
Yes, that's correct. Yeah.
Okay, so we're layering these codes to get more specific with what's going on.
Right.
Now, what if a physician doesn't provide enough detail about the heart failure?
Well, then we have to query the physician because
Okay.
we need to have all the information before we can code.
Makes sense. So this is all really important for making sure that down the line, the patient gets the proper care that they need, and we have accurate data for research purposes.
Yes, absolutely.
Okay, so let's shift gears a little bit here and talk about hypertensive chronic kidney disease.
All right. So if a patient has both hypertension and chronic kidney disease, we're going to use a code from I-12, hypertensive chronic kidney disease, and then add a code from N18 to specify the stage of chronic kidney disease.
So again, assuming that connection unless there's documentation saying otherwise.
Yes. And if the documentation specifies that the chronic kidney disease is not due to the hypertension, then we code it separately.
Okay, great. And again, more layering of codes to get down to the specifics.
That's right.
Okay, now what about a situation where a patient has hypertensive heart and chronic kidney disease?
Okay, so when a patient has hypertension that affects both the heart and the kidneys, we would use a combination code from category I-13.
Oh, okay, so that just bundles it all
Yeah.
together.
Yes, it does. However, we still need additional codes to specify the type of heart failure and the stage of CKD.
Gotcha. So it's bundling, but it's not quite bundling.
Right.
Okay, so again, really important to have that ICD-10-CM book handy, and of course the MCG manual as well, just to double check, make sure we're doing everything right.
Yes, this is where a flip and tap method comes in handy.
Yeah, can you walk me through how that would work in this particular scenario?
Yes. So first we're going to flip to the section in the MCG manual for combination codes. Then we would tap or tab annotate and place the specific guidelines for I-13 in our ICD-10-CM manual. So we might highlight the need for additional codes from I-50 and N18 and maybe make notes about sequencing based on the circumstances of the encounter.
So we're creating this nice little visual system so we don't miss anything.
Yeah.
Perfect. Okay, well, we've covered a lot of ground already, but I think it's probably a good time for us to take a little break. And when we come back, we'll jump into some more of these hypertension coding scenarios. Okay, so we've talked a lot about this presumed causal relationship, but what happens when the hypertension is actually caused by something else?
Okay, so that brings us to secondary hypertension. So secondary hypertension is when the high blood pressure is a symptom of an underlying condition.
So like something else is triggering it.
Exactly. And the coding needs to reflect that. So in these cases, we use two codes, one for the underlying cause and then one from category I-15 to specify that the hypertension is secondary.
Okay, so let's say a patient has a hormonal disorder that's
Yeah.
causing their hypertension. So we would code the hormonal disorder first and then the secondary hypertension.
Right. We would sequence the codes based on the reason for the encounter. But yes, the hormonal disorder is the root cause.
Right. So we're always thinking about that root cause.
Yes.
All right, cool. So now what about transient hypertension? So is that literally just temporary high blood pressure.
Yes. So it might be elevated for a short period, but it doesn't mean the patient has a chronic condition.
Okay, so how do we go about coding that?
If the patient doesn't have a pre-existing diagnosis of hypertension, we would use R03.0 elevated blood pressure reading without a diagnosis of hypertension.
But what if they do already have hypertension? Do we still use that same code?
No, if the patient has a diagnosis of hypertension, we wouldn't use R03.0. We would use a code from category I10 through I15 based on their hypertension.
Okay, so it's all about what their overall diagnosis is.
Right.
Now, pregnancy can make things a little bit more complicated too. So what are some things we need to keep in mind there?
Right. So we need to be sure to differentiate between transient hypertension that's not related to a pregnancy complication and gestational hypertension or preeclampsia.
So how do we code those?
So for transient hypertension that's not related to a specific pregnancy complication, we would use R03.0. But for gestational hypertension without significant proteinuria, we would use a code from O13. And for preeclampsia, we would use O14.
So proteinuria, that's protein in the urine, right?
Yes. It can be a sign that the kidneys aren't functioning correctly.
Okay. So again, it's really important to get specific with our coding.
Absolutely.
Okay, let's talk about controlled versus uncontrolled hypertension. It's as simple as it sounds.
Well, controlled hypertension means the patient's blood pressure is effectively managed with medication. So we would use a code from I10 through I15 for the patient's hypertension.
Okay, what about uncontrolled?
Uncontrolled hypertension means the patient is either not taking medication for their hypertension or the medication isn't lowering their blood pressure effectively. So again, we would use a code from I10 through I15 to code the patient's hypertension.
Okay, so it's not just about documenting that they have hypertension. It's also about, are they being treated for it effectively?
Yes.
Okay, now what happens if a patient's blood pressure gets really high and it becomes a hypertensive crisis?
Okay, so a hypertensive crisis is a sudden and severe elevation in blood pressure that requires immediate medical attention. It can be a hypertensive urgency or a hypertensive emergency, depending on the presence of target organ damage. But sometimes the documentation will just say hypertensive crisis.
So how do we code that?
If the documentation just says hypertensive crisis, we're going to use a code from I16 for hypertensive crisis. And then we'll add a code from I10 to I15 to indicate what type of hypertensive disease is present.
Okay, so again, layering those codes to get more specific.
Right. And we would sequence the codes based on the reason for the encounter.
Sure.
So if the hypertensive crisis is what brought the patient in, that code would come first.
So we're always trying to tell the story of the encounter through these codes.
Yes.
Okay, so I'm feeling a little bit more confident with all this, but I know there's still a lot to learn. So what else do we need to talk about?
Well, let's talk about pulmonary hypertension. So pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart.
Okay, and how is that different from the other types of hypertension?
Pulmonary hypertension is classified under I-27, other pulmonary heart diseases.
Okay, so completely different category then.
Right. And it can get a little tricky because we may need additional codes to specify the cause of the pulmonary hypertension or if it's due to an adverse effect of a drug.
So that's where having these manuals is really handy.
Yes, absolutely.
All right, now last but not least, let's talk about resistant hypertension.
Okay, so resistant hypertension is when blood pressure remains high despite the use of 3 or more different types of blood pressure lowering medications.
So it's just not responding to the treatment.
Exactly.
So how do we code that?
Well, we use code I1A.0 for resistant hypertension, but we also need to code the patient's type of hypertension from categories I10 through I15.
And so we're layering again, we're giving that full picture.
Yes, we don't want to just say that they have resistant hypertension. We want to specify what type of hypertension they have.
Okay, perfect. Well, I think this has been a really great overview of some of the complexities of hypertension coding. We've covered a lot of ground here today.
We have. I hope this was helpful.
Absolutely. And I think it's really highlighted just how important it is to have a good understanding of these guidelines.
Yes, and to be able to apply them correctly.
Right, because these codes have a direct impact on patient care and research.
Absolutely.
And for our listeners out there, if you want to learn more about this, we have a link to the MCG manual down in the description.
Yes, it's an excellent resource.
All right, well, that brings us to the end of our deep dive into hypertension coding. We hope you learned something new today. And as always, keep those brains curious and keep diving deep. Man, we've been through a lot with this hypertension coding.
We really have.
There's just so much to it.
It can be very complicated.
So as we kind of start wrapping up here, what are some of the most important things that people listening should remember?
Well, I think one of the biggest takeaways is that presumed causal relationship between hypertension and heart or kidney involvement.
Yeah, we've talked about that a lot today, and I think it's something that's really important to hit home.
Right. Unless the physician clearly documents otherwise, it's coded as related.
Exactly. Don't just assume it's unrelated because it doesn't say so.
That's right. And then also those combination codes we talked about, like I13 for hypertensive heart and chronic kidney disease.
Right, so it kind of bundles it up together.
Yes. But we still need those additional codes.
Right, to get down to the nitty-gritty.
Exactly. The type of heart failure or the stage of CKD.
So we're really building this really specific medical portrait of the patient.
Yes, that's a great way to put it.
And of course, we can't forget about sequencing.
Right.
That order matters.
Yes. Especially in those more complex situations like secondary hypertension.
Or a hypertensive crisis.
Absolutely.
It's like we're piecing together this puzzle,
You are.
making sure we're telling the whole story.
Right.
I think it's been really interesting to kind of dive into all this, and I hope that everyone listening has gotten a better understanding of just how important these codes are.
Me too.
It's not just about checking boxes.
No, it's fine.
It really does have an impact.
It does. It
Yeah.
impacts patient care research, the whole healthcare system.
Exactly. So if you're listening out there and you want to dive even deeper into this, we have a link to the MCG manual in the episode description.
It's a great resource.
So make sure you check that out. And with that, I think that wraps up another deep dive into the world of medical coding.
Thank you for having me.
Thanks for being here. Until next time, everybody, keep those brains curious and keep diving deep.